Welcome back, everyone, to Recharging the Human Battery radio show. I'm Dr. Stefano Sinicropi, your host. We are on AM 950 radio, and I'm really happy to have Mandi back today, my co-host, as we're gonna be chatting some mental health issues that affect the entire population. Mental health is such an important topic right now, and Mandi has had so much experience treating patients from a brain standpoint, but she's really an expert in mental health. And as you guys know, if you listened to the show before, she was involved in her own trauma, which was it was an accident and suffered a concussion. And part of that was PTSD, and that's what we're going to talk about today. It's such an important topic to talk about, and mental health, it's so critical for us as a medical community, but more importantly as a society, to be open and honest. Because honestly, if you just sit around and you just talk to anybody after they break down the barriers and say, hey, what was the hardest thing you've experienced, or what are you going through now? People have really significant mental health issues. And honestly, it's never been worse than it is today. And I don't mean to sound like kind of an old fogey, but the truth is, it is worse. It is worse today. I mean, statistically, we're going down a slippery slope. We've got social media. We have so many pressures. We have mass media. We have negative stories constantly, but then we have our own personal traumas. So we have personal traumas. We have kind of local traumas, what's going on in our local environment with our families and things like that. And then we just have societal traumas, right? Everything. We're in election season. We've got wars going on in the world. I mean, everything is topsy-turvy, and it's kind of a mess. And we can talk about so many different mental health issues, depression, anxiety, and there's so many things to talk about. But today we thought we'd talk about PTSD, post-traumatic stress disorder, because it's not just something that affects veterans. It's not. We talk about PTSD in the veteran, aspect, but it's so common amongst adults, kids, elderly, everyone. And so, thanks, Mandi, for being on the show today. What do you think about what I just talked about? I mean, is it as big about? Am I exaggerating this problem, or is it just a mess now?
It's a mess. It's a hot mess. There are so many words that can be used to describe that. But the statistics are one thing, but we'll get into this in the show today too, but the stigma around it is huge. So the statistics don't even match up with what we're actually seeing. In real life, the numbers are much higher than what we see online and we do any kind of search on the statistics. But it's there. It's real. It affects everyone.
Yeah, and we'll get into a little bit of your personal story. We talked about it a little bit before on a show, but more from the concussion standpoint, not really the PTSD standpoint. But we all suffer PTSD. I've gone through deaths in my family, and I feel like I still have some PTSD. From that. We just talked about your experience with your sister almost drowning, and people don't know this. This is literally the first time I've ever said this publicly. But when I was kind of in my, I would say my upper teens, kind of my mid to upper teens. I don't remember exactly how old I was, but I almost drowned off the coast of Long Island. With a friend. And honestly, when I think about that, I mean, it took a while to get over that, because it was just this repeating pattern of thoughts and having trouble sleeping. This is when I was younger. I mean, it's a long time ago, but I can still think about it. I was like, geez, I had PTSD then. Okay, not to mention I'm a surgeon, and I've been through a lot of bad experiences with patients. Obviously, we take care of a lot of really sick people, right? I know you've had that experience, right? With patients. It's like there's just so many.
Yep, and you have one bad experience, and then that haunts you forever. We just call it haunting us, but It's a form of PTSD. Yep. And then we worry that that's going to happen again the next time we come into that same situation.
Absolutely, and it's just such a major problem, and the more, we just talk to just people and counselors and schools and just my own patients and just my family members. I mean, PTSD is like. So it's such an important topic to talk about. Some of it is a little bit, it's not touchy-feely, but it is more of an emotional kind of, more of a psychology experience. But some of it is really hardcore science, what happens to the brain. So we're going to dive into all that on the other side of the break. We'll see you on the other side when we dive deep into this whole PTSD world, and hopefully you get something really good out of it. Dr. Stefano Sinicropi here, host of Recharging the Human Battery radio show. If you've been listening to me, you know how passionate I am about health and vitality. As founder of the Hypercharge Clinics, I'm dedicated to restoring your human battery to reboot your vitality, health, and performance. We focus on proactive wellness care, optimizing health and longevity by treating chronic conditions, chronic fatigue at the cellular level, all without medication or surgery. Do you suffer from chronic pain, disease, or just have low energy levels? Do you have more serious conditions? Well, Hypercharge Clinic is for you. We use non-invasive, non-operative modalities to improve your energy, slow aging, boost brain health, and help you to rapidly recover from injury and just to be your very best. Experience the future of wellness today. Call or schedule online for your free introductory session. Hypercharge is hope. Visit hyperchargeclinics.com now. All right, everyone, and welcome back to Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi. I'm joined by Mandi, Dickey, my co-host. So excited today to be talking everything PTSD. We are on AM 950 radio, and thanks for joining us today. You know, we're just gonna kind of talk through the whole post-traumatic stress disorder narrative. For those of you that are listening, I know that, potentially you might have been, suffering or are suffering now from PTSD, but without question, people that have PTSD, whether or not it's diagnosed. People have PTSD. It's a big problem, and the one thing that we can't do is we can't keep it on the inside, because when you don't talk about your experiences, and we can go everywhere from hardcore Western management of it through medications and other therapies and treatments, all the way up to spiritual healing and getting rid of trapped emotions and all these other things, or energy healing. There's just so many different ways to approach this. But the number one thing is to approach it. You've got to do something. You just sitting on the sidelines suffering in silence is the worst thing that people can do. And it can lead to things like suicidal ideation or even suicide. It leads to broken families. It's devastating for children that are undergoing PTSD because they can't really learn in school, and that puts them down a different path. And, they can waste, I don't want to even say waste, but they can suffer for years of their life where they're really in an emotional and physical development stage, and it can completely stunt them and send them down very, very bad paths, including criminal behavior and drug use and all kinds of other, unfortunate events. So the biggest thing is we really have to just keep talking about it. Again, I'm an orthopedic spine surgeon. I really got into the world of concussion and PTSDs after starting the wellness projects and the wellness clinics, and it's become a huge passion of mine. This is not something that I've spent my entire life studying, but we certainly learn enough about it through medical school and training. But until you really look for it, you really don't see it, especially if you're a surgeon, right? You know that people are suffering, but you just deal with, you're like, I'm going to do my spine surgery and that's fine, and they'll move on. But PTSD affects everything. It affects the way you recover, the way you perceive the world and whatever. So that being said, let's really dive into it. So Mandi, what is PTSD? And how does it happen? Like, what do we know? Like, what does science know about it? This is the first thing is we have to define it before we can approach it.
Mm-hmm. So PTSD stands for post-traumatic stress disorder. It happens after any kind of trauma. It can be a physical trauma, an emotional trauma. It can be from neglect. So that emotional trauma doesn't have to be something that's done. It can be something that's not done. And it affects anybody. And what we don't think about it is that it affects every aspect of our life, as you were saying. So the symptoms can be different in each person. Sometimes you get the outright, people get flashbacks, and that's the most obvious people thing that people think about. But you can also get irritability, difficulty concentrating, as you were mentioning with students. When it happens with kids, they have difficulty learning in the classroom. They have difficulty focusing and sitting still. Sometimes it can look like ADHD. It can look like other behavioral problems in children. The same thing in adults. Adults can have those same things happening. They get irritable. They start causing issues. They get into trouble. They can't sleep. Insomnia is a huge one as well. And all of those things compact and impact the person that's being affected as well as the people around them. Because when you get more angry because of PTSD, you take that out on the people that you love, right? So it affects so many different people. The statistics, as I was mentioning earlier, they shows about 20% of the population worldwide has PTSD. But we all know that that's not true because people don't always report it. And you have to report it in order to get that included in the statistics. When we talk about veterans, which is one of the most common ones, that's up to 40 to 50% of the population. It's much higher. Athletes. So we're finishing up the Olympics. Athletes at any level, whether it's kids, adults, professionals, they all have different pressures as well. So it could be an injury to themselves. It could be watching someone have an injury and all of a sudden they choke the next time they get up to the bar because they watch somebody else have a traumatic event on the bar. It can be the stressors that's put on them from their coach, from their families, from the media, we are all watching them as the United States. We're watching our athletes. We're putting pressure on them. So they're facing all of those different pressures and they train. We were just talking about this at work the other day. They train for 4 years to have 2 seconds on their event. If they're doing the vault, they get 2 seconds to run down that ramp. And that's it. That's what they do. They worked their whole life for those 2 seconds of fame. And if they choke, then, oh my gosh, it takes them on a tailspin.
Yeah, I mean, I think that we can talk so much now. The prevalence rates in veterans it's crazy and it's variable. I did some research. It's just variable. It depends on what. And again, it's just like concussion. Mm-hmm. It's not reported.
Yeah,
it's not reported. Most athletes and most people don't want to admit. They don't admit it to themselves, but let alone admit it to the world that they are struggling with mental health issues and PTSD. It's complicated. It's complicated. Even though we talked about like concussion before and how a lot of people that have concussions, we focus on the concussion part of it. But the truth is they've had a trauma. A lot of concussions are related to some trauma, whether it's a football injury, you get hit in the head with a soccer ball, or you fall off a ladder, or whatever happens. We're always focusing on, okay, you've got these concussions, but there's also PTSD, and there's such a blend, and it's so complicated that sometimes it just kind of gets lost in the shuffle, and people get, like you said, they get mislabeled. Like PTSD is different than a lot of forms of depression, and so if you label somebody with depression and you treat them for depression, but yet they have PTSD, then they might not get the right treatment, diagnoses. And again, we could bring some psychiatrists in here and neurologists, and everyone's going to focus on it in a different way. But the truth is, you just have to get to the matter. If one thing doesn't work, you get to the next thing. Great point on the athletes. And we were just talking about this the other day. Mm-hmm. I mean, imagine false starting after working for it's literally devastating. Or imagine, like Scott Norwood of the Buffalo Bills, missing a field goal when and the Giants win. Yep. Right? We can talk about a lot of Super Bowls where there were field goals missed. I mean, their lives are. Or how about Bill Buckner when the ball went under his legs? Right, for Boston. I mean, he couldn't even live in his neighborhood anymore. It was devastating. People are devastated. They don't sleep. They're irritable. But this happens all the time because there's so much pressure on them. I had Dr. David Barron, the Olympic psychiatrist, on my podcast, and we talked about this, and he just said PTSD is devastating in some athletes, and he knows all those athletes personally. He knows Simone Biles, who's gone through tremendous heartache and all kinds of depression and PTSD and anxiety, and she made a comeback. Why? Because she sought help. Yeah. And she's just a testament to it. I did a post on her, and it's just amazing. I'm just fascinated by her. I mean, one of the greatest athletes in the world. I mean, Michael Phelps. Yeah. Really bad mental health issues. So many athletes. I mean, we could go on and on about these athletes, but the truth is, we have to identify these things, and then we've got to make real changes. One of the couple things we talk about veterans. I did a whole show on veterans, and we talked a lot about PTSD and concussion and kind of ways back for them. And honestly, that has been, luckily, the U.S. government and the Veterans Administration has put a lot of efforts in. I was actually in D.C. lobbying, for photobiomodulation and some other things. There's a lot of talk on PTSD and concussion and things like that. So that was good to see. Another one that we didn't bring up, and we could sit here all day just talking about who gets PTSD. We talked about the students and stuff like that, but the COVID days, right? How about PTSD just from being locked up in your house?
Yep.
I think I still have a little bit about PTSD. Like we didn't know, but everybody reacted a different way. But it's when I think about that, it's not a happy feeling. Right? Not being able to practice surgery and being just like at home and having to wear a mask everywhere I go. I feel like I still have a little bit of PTSD from that. And we have it easy. I mean, some people were devastated by it. Think about kids that were into development. But the thing that, you want to talk about like high level stuff and unfortunately stuff that's depressing is all the kids that still have PTSD from what happened in COVID, because in the impoverished communities, there's just so much more domestic violence. And those poor kids, where their only outlet was going to schools, right? They were trapped at home with parents who were struggling, with it, and people were being, unfortunately, I don't want to sound morbid, but people, they were being beaten at home or having verbal abuse at home, and they had nowhere to go. They didn't have an out because the schools were closed, and it was devastating. And they're still suffering from PTSD. PTSD it's such a huge problem. And we really have to think about more ways that more people can get involved. So on that note, before getting into some of the, what are the options for people with PTSD and things like that, how do you diagnose PTSD? Let's do that one. And then I want to talk about all the different contact points where people need to be aware of PTSD and really like look in it in other people so they can send them rep. But again, how do you diagnose PTSD?
There's not a specific diagnostic test. There are questionnaires and screenings. So when I after my accident, for example, I went to my neurologist and he suspected I had PTSD. I contacted a therapist to work on it. She had me do this entire screening PTSD. So we had a score. So we looked at the severity of my PTSD. And then you can monitor that through treatment and make sure that that's coming down and responding. But there's not a specific imaging test. You can't do an MRI and identify it. You can't do a lot of tests and identify it. But it's a lot of clinical judgment. So finding that is going to be interesting, but identifying what areas can happen and what it can look like, and knowing that it can impact your patient's recovery. So we talked about how it goes along hand in hand with concussion. My concussion recovery was kind of on a standstill until I got my PTSD treated. And then once that was treated, then I could continue improving from that standpoint because there was literally a wall kind of holding me back.
Yeah, I mean, and that's real important. And the thing about PTSD, and again, this is something that, right? I mean, I'm a spine surgeon, and I've seen it. So in retrospect, I see what happens to people that have had injuries and they've had PTSD. Now I can recognize it a lot better because I talk about PTSD all the time. But even going back, I can think about all kinds of patients that had undergone traumas and things like that, that had PTSD. And in more lay terms, because, I'm not a psychiatrist, I'm not a neurologist. I didn't spend 12 years of my life understanding this stuff, or even like you, I didn't spend, time like with all these patients who have had brain injuries trying to rehab them. I've always focused on spine, but now knowing a lot of this stuff, but from a lay standpoint, and so something that, our audience can really understand, it's really like PTSD, like your brain it's a broken brain. Now, we say that in a lot of things, right? Schizophrenia is a broken brain in one way and other things, but it's really like your connections it's wrong. Yeah. Like there's a lot of things with PTSD that's wrong. That's why the flashbacks and the nightmares and the irritability and the insomnia and the lashing out and there's just all kinds of or it could even manifest in ways like severe procrastination where you're completely stuck. You can't do anything. You feel frozen, or panic attacks.
Or chronic pain syndrome.
Yes.
So there's a lot of patients that come in with chronic issues, and they don't have a specific trauma that they can say or anything that they can say that caused it. But I have a few people that have come on to my podcast and we've talked about it. Almost everyone has mentioned the book, The Body Keeps the Score. So when you've gone through some kind of trauma, you might not remember it, but your body does. And it holds on to that and it creates these chronic pain syndromes.
No, absolutely. And it's, I had this guy on my podcast, Neil Gannon, great guy. And he's got this 4 Pillars book. He's got a bunch of different books, but, we just talked about release. It's almost like the brain. It's interesting because it's an emotional, spiritual, but also actually physiological, right? The connections are that your wiring is wrong. Your synapses it's wrong. I don't know how else to explain this, but we have to talk because you can go from literally from the mitochondrial level all the way up to a completely like a complete spiritual level and an emotional level and all these other things. But it's one of these things where, and I know this has helped you obviously, but just talking about it all the time and just recognizing it and just trying to fix some of these other things and the brain really is broken and you just see that and people they're not, you cannot function normally anymore and it affects all of your relationships and everything you do. It affects your work, your ability to work. It affects your ability to be present with your family, right? Because you've got all these other things going on. And for our audience listening, it may sound like it's vague because it's vague.
Yeah.
That's I can't explain it. And so, right, if we can bring on a laureate neurologist and they can talk about all of the science to it, that doesn't help people necessarily recover. That might help you design a study in a lab.
Right.
And try to figure out, different molecules that we can use or different things, but it's very vague. And we don't do good with vague, right? Like the medical community, vague is no good. And they like it. And I love vague. I love the world of gray because then that allows us to really look at it more from an artistic standpoint. It's really an art. I mean, none of us are smart enough to understand all the science, right? We know like, okay, this molecule doesn't work or that molecule. That's not the whole picture. That's not the whole story. There's spiritualism. There's emotions and there's all these, these other things. It's very complicated. It's very vague, but you have to get help. And on the vague front, right, just like talking about just vagaries, the interesting thing about these and the reason that people feel so trapped, we talked about, I've talked about Groundhog Day repeatedly. People feel, this is really Groundhog Day, right? If you're trapped in this PTSD world and whatever. But you talk about vagaries. and you had these experience because not only are you a provider yourself that has dealt with a lot of patients that have this, but you also went through the system. And with PTSD, you can talk to 10 different providers in different or same specialty or in the same practice. Right? The same practice, whether it's psychiatry or neurology or therapist, and you're going to get like different answers, sometimes from the same therapist or psychologist or neurologist, because it is vague. Yep. And it's hard, and people want to live in these concrete worlds, and it just doesn't exist. Can you talk about how it's vague? Yeah. It's not easy. We're both scientists, right? We both have degrees after our names, but here we are just talking about, hey, this stuff, it's just vague and nebulous, and you can't quite put your finger on it. You just have to look at it from every different standpoint. We're big holistic people, and holistic medicine has helped you dramatically for all. And some people consider like neurofeedback, they would say that's like holistic. Yeah. Right? Everything's holistic other than drugs and surgery, right? For everybody, which is the opposite of other places in the world where, drugs and surgery are ludicrous, right? And holistic is just the way they treat people. But can you talk about how vague this is, like this concept of vagaries and PTSD?
I've kind of joked for years that, as a provider even, that there's not really a lot of black and white when it comes to these kind of things. It's all gray matter, right? It's the brain, it's gray matter. So I've kind of lightheartedly brought that out a lot of times. But everyone is wired differently. So it's the joy, it's the thing I've loved technology and the thing I've hated about it all the time, because everybody's wired differently. Two people can have the same brain injury and they're going to look very different because of how their synapses even sit on each other. Like what's going on in their brain. All the other experiences that they've had in their life is going to make it look different from one person to the next. So as we try to standardize as much as we can, you can't really standardize what people look like. So it makes it difficult coming up with a diagnosis. It makes it difficult coming up with a treatment plan, because what's going to work for one person isn't going to work for someone else. You might find one therapist or doctor or practitioner that you jive with, and you find another one that you think that you are oil and water. You can't mix whatsoever. So it's a process of going through and finding what works. If you're not finding answers, you need to find somebody else, because somebody else will be able to help you. Don't stop. And that's where the advocating for yourself always comes in on every show we talk about. It's
Be the
advocating
CEO of your
yourself.
own healthcare. We're going to say it.
You can't
over and
stop
over.
if you're not getting the answers that you need, because they're there. You're just not finding the right person.
No, I mean, no, absolutely, and you're right. It's gray matter.
Yeah.
It's a gray matter. The way I discuss it with my patients, and not even when I talk about pain, and how we approach pain, the psychological component. If they're suffering from PTSD, it changes everything, or depression, or anxiety, or all these other syndromes. Before we really think about it, most of the people we encounter that have a pain syndrome have an overlay of some psychiatric or psychologic issue. Chicken or the egg, It's there. We have to talk about it. I mean, I've done posts about that. It's like, as providers, no matter what the surgeries you're doing, I guess if you're just taking out an appendix, it's not like whatever. But when you're in the specialties where there's a lot of pain overlay and this and that, especially where you're just dealing with pain, not having some type of at least a fundamental grasp of how those other things affect, and you've got to fix it. But the way I talk to my patients is, I say the brain is, we're just like, it's just wires in a box, and when the wires are right, I have a computer in front of me. If I open this up and I change two wires, I mean, the screen might not work.
Right.
That's what happens and trying to figure out how to reroute that, from different methods, and we're going to talk about like how to approach that. Just really briefly, just because I think talking about how to tackle it, something I mentioned before, and we're just not going to have time to get into it. I think what's important, what I want people to take away from this, is that if you are an athletic trainer, if you're a teacher, if you're a parent, if you are working with anybody, if you work at a nursing home, if you're whatever, listening to us, but then really like trying to find some good information out there about PTSD and having an understanding of how to spot it, and what's wrong. We kind of just know, because we've been, we just know like when something's wrong, but knowing that. So I think, like, for example, coaches, athletic trainers, those people, they need some kind of training.
Yeah.
In this stuff. You have to know how PTSD is affecting, because it's not just affecting their performance on the field for these young athletes. It's them in school. It's affecting their concentration. It's affecting how they see the world. I mean, and again, we talked about it. You can get in a lot of trouble if you're in, because you don't know what to do and you lash out and whatever. Next thing you know, you can have a criminal record, for God's sake. I mean, it is. We got to be really careful with this stuff. So, without going, I think everybody should have some understanding how prevalent PTSD is, and it's everywhere. Again, the numbers, it's hard to say, and it's just like concussion, it's hard to say how many people have it, but it's a lot.
Yeah.
It's a lot, and people need help. So let's spend some time. So what would you say are the biggest ways to approach PTSD, and what's out there? Just big, like just generally big categories, and then we'll talk about my favorite, photobiomodulation.
Yeah.
I just had to get it out there. We'll get into it.
There's so many different ways you can treat it. I think the most effective way that I found was the EMDR, eye movement desensitization. Oh my gosh, I can never come up with words. Desensitization and retraining.
Yeah.
So you're literally changing the way you respond, changing your brain's response to the trauma itself. So it's not making the trauma go away. it's making the response go away to it. That was the biggest thing that helped me. There are so many different ways to treat it, though, and I've my podcast, Brain Wellness, I've had a lot of different people come on, and they've all been coaches of different ways. They're even, I loved it when we got the quantum bed, because there's quantum realm when you're thinking about trauma recovery too, because not everybody remembers the trauma that they've been through. So you can get there by doing all these quantum movements and energy therapies, because you can get at the root cause of the symptoms without having the trauma itself come up. So some people can't handle going through even working with a therapist to do the EMDR, because you have to experience the trauma again. That's one way to do it. You can treat it without having to experience it. So it's going to be based on what each person individually can do. But yeah, the photobiomodulation is another way to do it. The laser therapy, there's so many different ways to get at it. And sometimes it's going to take multiple layers. One thing is not going to be the end all be all of it.
Yeah, I think that the bottom line is, again, you know, none of the things we talk about is meant to be medical advice. So you guys got to go out there and find good things. So what you talked about is kind of under the realm of kind of psychotherapy, or psychotherapists do it. But there's other people. Like I had a Dr. Candace was on my show, and she's a chiropractor, but she does neurofeedback, and she takes care of all kinds of people that have had either TBIs or post-traumatic stress disorder, and all these different combinations. There's group therapies that people can do that are very helpful. You're right. Reliving the trauma is a thing I talked about, like releasing these trapped emotions. So sometimes you can undergo like really intense thing and like relive the whole thing, and then try to get out of it. And there's like narrative exposure therapies. They're way beyond the scope of this show. And certainly you can't even if you bring on, like you bring on a lot of these on your podcast, right? Each person's going to have their way of doing it, and it might work for one person and it may not, work for another person. We haven't gone into like medication management, right? There's the SSRIs, there's SNRIs, there's all these other medications that are out there. Again, way beyond the scope of the show. Those have to be prescribed by, a licensed physician or nurse practitioner or whoever you go to that is allowed to prescribe those drugs. But I asked Dr. David Barron, again, the Olympic psychiatrist. He's been doing it forever, for decades. I mean, he knows all these athletes. I mean, he's friends with all these people, right? I mean, and I just asked him about generally for athletics or just in general, and I love the fact that he's this decorated guy and he has all these amazing books and all these other things, but he's a psychiatrist, so he has the power of the prescription pad, and it's the last resort for him. He's like, it's the last resort. Now, for very severe conditions, if somebody's suicidal, if somebody has severe resistant depression or PTSD where they haven't, obviously medication management is indicated, right? And again, I'll leave it to if you guys are suffering out there, I'll leave it to your providers to make that decision. But there's so many other things under the general realm of psychotherapy and neurocognitive feedback and these other things. But there's other ways of really attacking it. And one of our favorites is using light therapy, either through LED lights, which is a little bit less powerful, and then laser therapy directly to the brain. And the fascinating thing about that, and again, you know this, I mean, I didn't know any of this stuff, 2 years ago, and now I talk about it ad nauseum. And that is, we have to approach the broken brain both from trying to fix the actual because interestingly, there's changes. So in TBI, there's actual damage to the connections, but connections can turn on and off depending on how it's wired. And so when you have PTSD, you're rewired. You're wired wrong. So there's a couple different ways. So through neurofeedback, psychotherapy, group therapy, whatever, you're fixing those connections more by thinking through it and changing them by changing, right? 'Cause like neurons that fire together, wire together. We can go into all these like sayings, but the truth is, the more you think about something, the more that's wired, and you want to kind of unwire all the bad wiring that happens through PTSD by wiring something else. Yeah. And that's what you talk about with this, with the EMDR.
Yeah.
right? Like you're just kind of changing or your response to it,
Yeah.
right? And you're continually you're getting to a different response. That is a way to do it through neurofeedback and other things. And you can watch either of our podcasts because we have guests that have talked about these things. And it's very fascinating stuff. But the reason that the light therapy is fascinating, and I had Dr. Michael Hamlin on the show, and I also had Dr. Cassano. I mean, those are the gurus. I mean, those are they're the world-renowned leaders. Michael Hamlin has 1,500 papers, 60 textbooks plus whatever it's ridiculous. And we were talking about PSD and rewiring the brain. And one of the things that I've changed after talking to him is the way that I try to frame this, because everything is trying to frame it to people so they understand. And the one thing that he really talked about is the fact that red light therapy to the brain, or laser therapy, which is more powerful, it's the same thing, the same kind of, it's about wavelengths and penetrating the skull. But what it does is it creates synaptogenesis. So it's de novo connections between your nerve cells. And so that can help to repair the actual physical problem. And then you throw on neurofeedback, and we've talked about the neuroglove and all kinds of stuff. We can have entire other stuff, but combining physically, that is what is exciting to me, because there's no drugs that fix the brain. You can't take. There's no drugs that I know of that are going to be great without massive. Again, this is not my area of expertise, but the beauty about light therapy is it actually enhances connections between the neurons. How people are not like jumping up and down trying to get this, I have no idea, and I never thought I would become a messenger of this. It's the last thing I ever thought I'd be the messenger of, but it's and I can tell you that Dr. Hamlin, when I talked to him about it, he said this. I have that podcast comes out this weekend, but he basically says, well, this weekend for those of you that we'll see. Anyway, but one of the things he said is there is no reason not to do light therapy on the brain for every single psychiatric and neurologic condition, period, because it's safe. And it fixes the brain. It heals the brain. It heals the brain's connections. And so this message needs to get out. And people, if you guys listen to this radio show, you're going to hear a lot about. I mean, we might be talking about some random thing. I'll just throw in light therapy because I can't help I can't help myself. And certainly, we do a lot of this at our clinics, but that's not the point. I don't care where you have it done. Just think about light therapy to the brain. So I think this combination that not many people are offering. Mm-hmm. People are not saying, hey, let's fix the actual connections in your brain physically by shining a light on it and changing the neurons, literally regrowing the connections between them, and then let's rewire them. Even though if you regrow the connections, but you keep wiring the old connections, it doesn't work. So you have to rewire the connections through cognitive retraining and all these other things, yep. Right? Am I missing anything?
Yeah.
On that too, it's really a two-headed, it's really layered.
Because you can't, there is not one therapy in our traditional or non-traditional ways of thinking that's going to work for everybody. You have to do the layers, and my recovery was a testament to that. As I added each of the layers, I found more recovery and my brain started working better. It wasn't just any one particular thing. It was all of them together.
And I think one, as our, as we really needed more time for this show, guys. The other thing, there's a whole other overlay on it. So anytime we have, any thought that we have, anything that happens, like we're experiencing something now, there's literally thousands of chemicals that are being released in our body. There's the big ones, though, right? There's the serotonin and the dopamines, and the big one is cortisol. Mm-hmm. And so when we talk about fixing it, I would say that the third pronged approach that has to be thing is you have to fix other things. And so, like, if you have cortisol dysregulation, which is a huge thing, otherwise known as burnout, for people, like, if you have a very bad cortisol problem and you're trying to fix your PTSD, you got to fix all these other things. And that's where, even though as we're both hardcore Western trained providers, but we see there's massive gaps in Western medicine, because if you're not doing that, so even if you're seeing a provider and they're just doing one of the things, if you're just doing neurofeedback, but you have a massive cortisol problem, or you're not trying to rewire the brain, or whatever, it has to be a holistic, combined well, I don't want to say naturopathic because neither of us are naturopaths, but it is a way, but a natural approach or a holistic approach combined with more sophisticated, and we didn't even get into doing QEEGs for this and how the brains work and different wave patterns, that work. So, I think as we wind down, once we get to the other side of the break, we'll talk about, some of these other things. But do you agree? I mean, you have to fix, adrenal, deficiencies and other things that happen. And some of this, again, Western medicine thinks is fluff, but it's not. It's so important. And again, I've had guest after guest. The cortisol problem is huge to fix.
Yeah. That old saying, "It takes a village," is true. It takes it in every aspect.
Yeah, and I'm just so grateful that I got into this world of things outside of Western medicine, because otherwise all I'd be sitting around is thinking about, what screw size I'm going to use for this thing. I know that. I mean, I've been doing that for 20 years. I get that. I understand. There is so much more to fixing people than just doing surgeries on them or giving medication. On the other side of the break, we'll have some parting thoughts. Comes to PTSD. Hopefully this has helped some. But again, there's so many resources out there that you can use to get more information, and we'll see you on the other side of the break. Chronic disease, poor sleep, post-surgical recovery, aging, brain health, low energy, post-COVID syndrome, addiction, recovery from injury, cognitive decline. As a long-time practicing surgeon, I wanted to design a clinic that could address all of these issues without medications or surgery. This is Dr. Stefano Sinicropi here, host of Recharging the Human Battery Show and founder of Hypercharge Clinics. And I know it seems too good to be true, but believe me, it's not. Hypercharge Clinic specializes in optimizing health and longevity, combating the symptoms of chronic disease by treating the cause at the source, the cellular level of the body, by targeting the core of our cells, the mitochondria, with non-invasive therapies like Class 4 laser, red light, and many others. We are introducing a new era of medicine that promotes faster healing, pain relief, wellness, and human performance like never before. Experiencing is believing, so call us and schedule your online free introductory session today. Visit hyperchargeclinics.com now. Hypercharge is hope. All right, welcome back to Recharging the Human Battery Radio Show. I'm your host, Dr. Stefano Sinicropi. I'm here with Mandi, Dickey, our esteemed nurse practitioner, and we've been chatting everything here on AM 950 radio about PTSD and how it's gray, and how you really, really need to be out there, and seek help. One of the things we really didn't get a chance to talk about, but that's a whole other show, is the whole mass media thing and social media and cyberbullying. So many kids have PTSD from cyberbullying. It's heartbreaking. Their suicide rates have gone up, after the pandemic. My buddies that are pediatric guys that work in emergency rooms say they've never seen this much psychiatric disorder in this level of population, younger and younger. I mean, this is the ER. This is not like, my kid's sad. I mean, this is like serious suicidal ideation, and even unfortunate, suicides, or people that have taken pills and things like that. So it's a huge problem, and we really can't talk about it enough. But again, this goes everywhere from, veterans who come back from combat, are around, have artillery shells going over their head, or have seen people die, or always, every moment, every door they peek around, right? That can cause, we don't know what, and very simple things could cause this as well. But, it is such a broad topic. So hopefully, you got to see how even we, who treat people all the time and talk to people all the time, how we find it a very gray area and we seek help. Mandi has sought her own help in so many different areas. I look to all these different people to learn about it. We didn't even talk about other potential things that can help in PTSD, other holistic options, acupuncture. How does that, how does that work? We could have talked about some of the studies in that, and you talked a little bit about energy medicine and healing and Reiki and all these other things. Listen, there's some controversy behind anything. Everything's controversial. But again, you have to understand who's making it controversial. Mm-hmm. So I think the bottom line for today, and I'll let Mandi, kind of say her piece here before we have to let you guys go. And I'm actually sad because I wish this show was going on for another hour, because we could talk about this, so much more. But I think the bottom line is being open and honest about what you see in others and what you see in yourself, and talking about it and seeking help, really legitimately seeking help, not having stigma, understanding that there is no room for stigma anymore with mental health disorders. It's just ridiculous that we even have stigma. It's ridiculous. Right. And anybody that I hear talking bad about somebody or calling people nuts or crazy or stuff like that, have you lived their life? Do you know what they're experiencing? You have no idea what they've gone through. People go through hell, and come back. And then hopefully you've got a little bit of a flavor on what's out there. What are you, anything in closing that you'd like to add on what should people be doing? What's the takeaway?
Kind of reiterating, I share my experience so that I can help other people. And if I share one other person by sharing my experience, that's good for me. But by sharing it, it shows that it can happen to anybody. As a provider myself, I've been through this, and I know what it feels like, what it looks like now. So hopefully that'll make me a little bit more of an empathic provider going back. But at the same time, just share your experiences, share your thoughts, because you never know if that trauma that you had in the past might be contributing to the problem that you're experiencing now. You might not recognize it as PTSD. Just share those feelings, share the symptoms, talk to your providers. And again, if you're not getting the answers you want, look for somebody else, because there's going to be somebody that can help you.
Bingo. Seek care. Look around. Do your research. Go out there and find the right providers. Find multiple providers, right? Get light therapy. Get these other things. Like really, really do your research on this stuff. I know personally, in closing, I can tell you, I know a lot of physicians who have been through really bad experiences, whether it's patient experiences or experiences with hospital systems or getting in trouble with the medical boards and stuff. They have severe PTSD. Yeah. And some of them have had to actually leave medicine for a while or altogether. So on that note, it can happen to all of us. It absolutely can happen to all of us. I hope you enjoyed the show. Go out and take care of yourselves, take care of your loved ones, be CEOs of your own health, and we'll see you on the next program. And really sad to be leaving you guys today, but have a wonderful day.